If you are over 60, taking blood pressure medication, trying to eat reasonably well, and still hearing that your blood pressure is too high, too unstable, or not quite where we want it, then what I'm about to say may change the way you think about hypertension for the rest of your life. Because most people have been taught something far too simple. They've been told high blood pressure is just a numbers problem. Too much pressure, too much salt, too much stress. Take a pill, bring the number down, problem solved. But what if that isn't the full story? What if the number is only the surface? What if high blood pressure is actually a signal, a warning, that something deeper inside the blood vessels is breaking down? As a physician who has spent more than 2 decades caring for older adults, I can tell you this with complete honesty. Many people are not failing blood pressure treatment because they're careless, lazy, or just getting old. Many are failing because the conversation they were given was incomplete. Your arteries are not dead plumbing. They are living tissue. They respond to sugar, insulin, inflammation, stress, sleep, movement, oxygen, and the health of the cells lining the vessel wall. And when that system begins to lose its flexibility, its protection, and its ability to relax, blood pressure rises for a reason. That is why today we are going deeper than the usual advice. In this video, I'm going to walk you through what high blood pressure really is, why so many adults, especially older adults, keep struggling with it even while taking medication, what happens when the protective lining of the arteries gets damaged, why stiff arteries silently drive the pressure higher, why nitric oxide matters more than most people realize, how insulin and the kidneys can trap the body in a high-pressure state, and most importantly, what practical steps may help support real repair at the root. Not overnight, not magically, but meaningfully. And let me be clear right now, this is not a message to throw away your medication or replace your doctor with a video. It is a message to understand your body more deeply, so that you can have a better conversation, make wiser choices, and stop seeing hypertension as something mysterious that simply happens to you. Because once you understand the mechanism, the fear changes, it becomes clarity, and clarity gives you power. So before you accept that high blood pressure is just part of getting older, stay with me. Because what you're about to hear is not just about lowering a number. It's about protecting your brain, your heart, your kidneys, your mobility, and the independence that matters so much in later life. If you are over 60, taking blood pressure medication, trying to eat reasonably well, and still hearing that your blood pressure is too high, too unstable, or not quite where we want it, then what I'm about to say may change the way you think about hypertension for the rest of your life. Because most people have been taught something far too simple. They've been told high blood pressure is just a numbers problem. Too much pressure, too much salt, too much stress. Take a pill, bring the number down, problem solved. But what if that isn't the full story? What if the number is only the surface? What if high blood pressure is actually a signal, a warning, that something deeper inside the blood vessels is breaking down? As a physician who has spent more than 2 decades caring for older adults, I can tell you this with complete honesty. Many people are not failing blood pressure treatment because they're careless, lazy, or just getting old. Many are failing because the conversation they were given was incomplete. Your arteries are not dead plumbing. They are living tissue. They respond to sugar, insulin, inflammation, stress, sleep, movement, oxygen, and the health of the cells lining the vessel wall. And when that system begins to lose its flexibility, its protection, and its ability to relax, blood pressure rises for a reason. That is why today we are going deeper than the usual advice. In this video, I'm going to walk you through what high blood pressure really is, why so many adults, especially older adults, keep struggling with it even while taking medication, what happens when the protective lining of the arteries gets damaged, why stiff arteries silently drive the pressure higher, why nitric oxide matters more than most people realize, how insulin and the kidneys can trap the body in a high-pressure state, and most importantly, what practical steps may help support real repair at the root. Not overnight, not magically, but meaningfully. And let me be clear right now, This is not a message to throw away your medication or replace your doctor with a video. It is a message to understand your body more deeply so that you can have a better conversation, make wiser choices, and stop seeing hypertension as something mysterious that simply happens to you. Because once you understand the mechanism, the fear changes. It becomes clarity, and clarity gives you power. So before you accept that high blood pressure is just part of getting older, stay with me. Because what you're about to hear is not just about lowering a number. It's about protecting your brain, your heart, your kidneys, your mobility, and the independence that matters so much in later life. Let's begin with the question almost nobody asks, even though it should be the first question in every serious conversation about hypertension. What is high blood pressure actually telling us? Because if all we do is stare at the reading on the cuff, we miss the deeper message. A blood pressure number is not the disease itself. It is a sign, a clue, a visible signal of forces happening beneath the surface inside the cardiovascular system. And that distinction matters more than most people realize. Nearly half of adults in the United States live with high blood pressure, and many of them are already taking medication. Yet a large number still do not reach stable control, or they reach it only temporarily, or they bring the number down while the deeper vascular problem keeps progressing. That should tell us something very important. Hypertension is not always just a too much fluid problem. It is often a vessel health problem. Think about a healthy artery for a moment. A healthy artery is not rigid, it is not inflamed, it is not scarred, it is not fighting the blood passing through it. It has a smooth inner lining. It responds to demand. It can relax when needed. It can widen. It can absorb some of the pulse from the beating heart and help circulate blood efficiently without excessive strain. Now imagine what happens when that system changes. The vessel wall becomes irritated. The protective lining becomes damaged. The artery becomes less flexible. The signals that tell it to relax become weaker. The kidneys begin holding on to more sodium. Inflammation starts whispering in the background every single day. At that point, the blood pressure number rises for a reason. This is why so many people become frustrated. They think, I'm taking the medicine. Why is this still a problem? Or, why did my doctor add another prescription, but I still don't feel truly better? The answer, in many cases, is that we are treating the pressure without fully addressing the environment that created the pressure. And that is especially important in older adults. Because in later life, hypertension is not just about future risk in an abstract sense. It is about what it does to daily life. It is about stroke. It is about heart strain. It is about kidney decline. It is about dizziness. It is about brain health. It is about the slow erosion of confidence that happens when the body feels less steady, less resilient, less cooperative than it used to. That is why I refuse to treat this topic like a math problem. This is not just 150 over 90 versus 130 over 80. This is about whether your blood vessels are helping you age well or quietly working against you. And once you understand that, the entire conversation changes. Because then the goal is no longer just to lower pressure. The goal becomes restoring conditions that allow the vascular system to function more normally again. That is the beginning of intelligent blood pressure care. And the first place we need to look is Now here is where it gets really interesting. Inside every healthy blood vessel is a microscopic protective layer called the glycocalyx. Most people have never heard the word. Many patients go their entire lives without a doctor ever mentioning it. But this thin, gel-like coating may be one of the most important guardians of vascular health in the entire body. Think of it as a soft, protective forest lining the inside of your arteries. It helps regulate how blood flows across the vessel wall. It protects the delicate inner surface from damage. It helps maintain normal vessel signaling. It acts like a buffer between circulating blood and the endothelial cells underneath. And when that layer is healthy, blood vessels behave better. But when it is damaged, trouble begins quietly. This is one of the hidden reasons high blood pressure can develop long before someone feels seriously sick. So what harms the glycocalyx? High blood sugar is one of the biggest offenders. Repeated glucose spikes from refined carbohydrates, sugar-heavy meals, and constant snacking create biochemical stress that slowly erodes this protective layer. Add oxidative stress, chronic inflammation, poor sleep, smoking, inactivity, and metabolic dysfunction, and the damage accelerates. Then the endothelial lining underneath starts to suffer. The endothelium is the living inner skin of the blood vessel. It helps control constriction, relaxation, clotting balance, and inflammation. When it is healthy, arteries stay calmer, smoother, and more responsive. When it becomes dysfunctional, vessels lose their grace. They become more reactive, more inflamed, and less able to relax. And that is when blood pressure begins to rise in a more persistent way. Let me tell you about a type of patient I see all the time. A woman in her late 60s or early 70s comes in and says, "Doctor, I don't understand it. I'm not eating terribly. I'm not adding salt to everything, but my blood pressure keeps creeping up." And when you look deeper, you often find a pattern: a little abdominal weight gain, a little more fatigue after meals, poor sleep, borderline glucose, more processed foods than she realizes, and signs that the vascular lining has been under assault for years. This is why hypertension is not just about force. It is about tissue health. If the inside of the artery becomes irritated and damaged, the vessel stops acting like a healthy, intelligent organ. It starts acting like a stressed structure defending itself all the time. The result is more resistance, less flexibility, and more pressure. That is the hidden beginning of the story for many adults. And here's the hopeful part. Damage at this level does not mean the body is doomed. It means the body is asking for a different environment: less sugar volatility, less oxidative stress, more real food, more polyphenols, better movement, better sleep, better metabolic control. Because if the inside of the vessel has been injured, then real progress can. Nitric oxide may be one of the most important molecules in blood pressure regulation that almost nobody talks about outside of cardiology, vascular biology, and sports physiology. And yet your blood vessels depend on it. Nitric oxide is a signaling molecule produced in part by the endothelium, the inner lining of the arteries. Its job is elegant and essential. It tells the smooth muscle in the blood vessel wall to relax. It helps vessels widen. It improves circulation. It reduces unnecessary tension inside the vascular system. In many ways, it is one of the body's most important let-go signals. When nitric oxide is produced well, blood vessels behave more like they should. They open, they adapt, they deliver oxygen more efficiently. They reduce resistance without the body having to force the issue. But when nitric oxide production falls, the opposite happens. Vessels become more constricted, more irritable, less responsive. Blood moves through a tighter system, pressure rises, organ perfusion becomes less efficient, and the body starts living in a more contracted state. Why does nitric oxide fall? A damaged endothelium is one major reason. If the vessel lining has been injured by sugar spikes, inflammation, smoking, poor sleep, or metabolic dysfunction, nitric oxide production drops. Sedentary living contributes too. So does aging, especially when aging is paired with inactivity and poor vascular care. Even breathing patterns matter more than most people realize. Chronic mouth breathing, shallow breathing, and a persistently stressed nervous system can all work against the relaxed physiology the body needs. That is one reason some older adults say, "I feel tight, I feel tense, I feel like my circulation isn't what it used to be." Sometimes they are describing nitric oxide poor vascular function without knowing the term. Now let me translate that into everyday life. If nitric oxide is low, stairs feel harder, walking feels less fluid, hands and feet may feel colder, recovery after effort can feel slower, blood pressure becomes more stubborn, and the body loses some of that quiet adaptability that makes people feel physically capable. This is why movement matters so much. Physical activity does not only burn calories, it stimulates the blood vessels. It encourages better endothelial signaling. It supports nitric oxide production. Even relatively simple training, especially regular walking and certain isometric exercises, can help the vessels relearn some of their healthy behavior. Nasal breathing matters too. Your nose is not just for smelling things. It plays a role in airflow quality and nitric oxide physiology. Many people live in a constant low-grade stress state, breathing through the mouth, sleeping poorly, rushing through the day, and wondering why the body never truly settles. The vascular system feels that. So when we talk about helping blood pressure, we are not just talking about drugs. We are talking about sending your arteries a bet. Now let's talk about the part almost no one connects to blood pressure until they understand metabolism more deeply. Insulin. Most people think of insulin only in the context of diabetes or blood sugar. But insulin has powerful effects beyond glucose. One of the most important for this conversation is what it does to the kidneys. When insulin levels stay high, especially in people with insulin resistance, the kidneys can be pushed to retain more sodium. And when the body retains more sodium, it tends to retain more water. That increases circulating volume. More volume inside a resistant vascular system often means more pressure. So now think about the bigger picture. If the artery lining is damaged, the vessels are stiffer, nitric oxide is lower, and insulin is telling the kidneys to hold on to sodium, high blood pressure stops being mysterious. It becomes almost predictable. This is one reason so many people with hypertension also have central weight gain, rising fasting glucose, fatigue after meals, sugar cravings, or a history of borderline metabolic labs. They are not dealing with isolated blood pressure. They are living inside a metabolic environment that keeps reinforcing the problem. And that matters enormously in older adults. Because by the time someone is in their 60s or 70s, this pattern may have been building for years, maybe decades. A little too much refined food, too little muscle activity, too many glucose spikes, too much snacking, not enough deep sleep, more abdominal fat, less metabolic flexibility. Eventually, the kidneys, vessels, pancreas, and hormones start participating in the same unhealthy symphony. The result is not just high blood pressure. It is a body that feels harder to manage. Patients say things like, "I gain weight more easily now. I feel puffy. My blood pressure and blood sugar seem to rise together. I'm hungry all the time. I crash after meals. I feel like my system is always a little inflamed." They are often right. And here is the crucial point. If insulin is part of the driver, then simply chasing sodium without addressing insulin may never fully fix the issue. Yes, sodium matters. But why is the body holding on to it so aggressively in the first place? That is the smarter question. Now, I want to be careful and responsible here. Not every case of hypertension comes from insulin resistance, and not every older adult should start extreme dieting or fasting without guidance. But if you ignore insulin entirely, you leave out one of the most powerful hidden levers in the entire picture. And once that lever is understood, the path forward becomes more strategic. You stop thinking only in terms of restriction. You start thinking in terms of repair. Repair the vessel lining, reduce inflammatory food signals, improve nitric oxide support, lower insulin burden, help the kidneys stop clinging to sodium unnecessarily. That is how you move from managing the symptom to changing the environment that The first step in supporting real blood pressure improvement is to stop injuring the vascular system every day without realizing it. That means we begin with the glycocalyx and the endothelium. If high sugar exposure, refined carbohydrates, oxidative stress, and chronic inflammation have been scraping away at the inner protection of the arteries, then the repair process starts by reducing those assaults. And that does not require perfection. It requires consistency. The most important dietary shift for many people is not eat less in a vague sense. It is reduce the foods that create repeated glucose spikes. That usually means cutting back on liquid sugar, sweets, white flour products, ultra-processed snacks, and the constant grazing pattern that keeps insulin elevated from morning until night. Why does this matter so much? Because the vessel lining needs a calmer environment to recover. When every day is a roller coaster of glucose and insulin, inflammation stays louder, oxidative stress stays higher, and the endothelium remains irritated. But when meals become simpler, steadier, and less refined, the body begins receiving a different message. Not emergency, not overload, not damage, stability. That is where healing begins. Now here's where food quality becomes powerful. Polyphenol-rich foods can support vascular health in ways many people underestimate. Berries, pomegranate, extra virgin olive oil, green tea, cocoa with minimal sugar, colorful vegetables, herbs, and deeply pigmented plant foods all provide compounds that may help calm oxidative stress and support endothelial function. These are not magic bullets. They are repeated biological votes cast in favor of repair. Some people also explore compounds like fucoidan, a substance derived from certain brown seaweeds, because of its potential role in supporting glycocalyx-related and vascular health. I would frame that as a conversation to have with a knowledgeable clinician, especially if you take medications or have multiple conditions. But the larger lesson is still the same. The blood vessel lining is responsive. It is not fixed in stone. Now let me make this practical. A breakfast that spikes blood sugar and leaves you hungry 2 hours later is not helping. A day built around refined snacks is not helping. Drinking calories all day is not helping. Sleeping 5 broken hours and calling it normal is not helping. But a routine with steadier meals, more protein, more fiber, more plant compounds, fewer glucose surges, and more time between eating episodes may give the vascular lining a chance to breathe. And in older adults, that matters more than ever. Because the goal is not just avoiding a diagnosis on paper. The goal is preserving the softness, responsiveness, and intelligence of the vascular system so the body can continue to support walking, thinking clearly, recovering from effort, and staying independent. That is why I tell my patients this. Blood pressure is not only about force. Once the vascular lining is being protected, the next step is helping the arteries become less stiff and less hostile to blood flow over time. This is where mineral balance and vascular support start to matter. One of the concerns in aging arteries is that calcium can end up in the wrong place. Calcium belongs in bones and teeth. It does not belong hardening the arterial wall. When the body loses some of its ability to direct minerals properly, the vessels can become more calcified, more rigid, and less responsive. That pushes blood pressure higher and makes the heart's job harder. This is one reason nutrients such as vitamin K2, vitamin D, and magnesium are often discussed in the context of vascular health. K2 is especially interesting because it plays a role in helping calcium get guided into more appropriate places rather than lingering in soft tissue. Magnesium matters too because it supports muscle relaxation, nerve function, metabolic balance, and healthy vascular tone. Vitamin D is important as well, but it needs to be approached thoughtfully, not carelessly. Now, this is not a prescription block. I am not telling every viewer to start supplements blindly. I am saying something more useful. If arterial stiffness and calcification are part of your hypertension story, then the quality of your mineral regulation matters. And that deserves a real conversation with a clinician who understands the bigger picture. But nutrients alone are not the whole answer. Movement is medicine here too. When muscles work, vessels respond. When circulation improves, arteries receive better mechanical signals. When the body spends less time sitting and more time using its cardiovascular system the way it was designed to be used, vascular behavior often improves. One particularly interesting tool is isometric exercise, controlled, static muscular effort such as wall sits or hand grip training under appropriate guidance. These forms of exercise can create helpful signals for blood pressure regulation in some people, especially when done consistently and safely. And then there is magnesium's quieter cousin in this story, relaxation of the nervous system itself. A body that is permanently braced tends to run higher pressure. A body that never settles, never sleeps deeply, never exhales fully, often pays for it in the vessels. That is why stress management sounds soft, but has hard biological consequences. So if we are serious about helping stiff arteries, we have to think wider than the pharmacy. We think about mineral handling, we think about vascular tone, we think about muscle activity, we think about sleep, we think about chronic tension, we think about whether the body is constantly living in brace mode. This is especially important for older adults who have been told, often for years, that the answer is just another pill. Medication can absolutely be necessary. But vessels do not become supple because we ignore the environment that made them rigid. They impro. Now let's bring everything together into the most practical part of this entire video. If you want to support healthier blood pressure from the inside out, 4 goals matter more than almost anything else. Protect the vessel lining, reduce arterial stiffness, increase nitric oxide support, lower the insulin burden that keeps the kidneys clinging to sodium. And the good news is that many of the daily actions that help one of those goals also help the others. For example, time-restricted eating, done reasonably and safely, may help reduce the constant insulin stimulation that comes from eating all day long. Giving the body longer breaks between meals can help insulin settle, reduce metabolic noise, and make it easier for the kidneys to stop living in sodium hoarding mode. That does not mean starvation. It means structure. It means letting the body finish one metabolic task before forcing it into the next. Next, think about your day in terms of circulation, not just calories. Are you walking enough to stimulate your vessels? Are you spending long hours seated without interruption? Are you challenging your muscles in any safe, regular way? Are you giving your arteries a reason to stay flexible? And then think about breathing. This sounds small until it isn't. Chronic mouth breathing, shallow upper chest breathing, and a body locked in stress can keep you stuck in a physiology of constriction. Slower breathing, nasal breathing, better sleep hygiene, and a calmer nervous system may sound gentle, but they are not trivial. They influence pressure, recovery, inflammation, and vascular tone in real ways. Then comes the food question. Not what superfood fixes hypertension. That is the wrong question. The better question is, what pattern reduces injury to my vessels every single day? Usually that means fewer refined carbohydrates, fewer sugar spikes, more fiber, more protein balance, more colorful plant foods, more polyphenol-rich choices, fewer processed snacks, and a meal rhythm that stops overwhelming the system. This is where many patients finally feel relief, because they realize the body is not broken beyond repair. It is oversignaled, overfed in the wrong ways, undermoved, underrested, undersupported. And when those patterns change, blood pressure often becomes easier to manage because the body is no longer fighting the same biochemical battles every day. Now I want to leave you with one final principle before we close this section. Do not think in terms of hacks. Think in terms of terrain. If the terrain inside the body is inflamed, stiff, insulin-heavy, nitric oxide poor, and constantly irritated, hypertension will keep finding ways to return. But if the terrain becomes calmer, softer, more responsive, and more metabolically stable, the pressure often becomes easier to improve. That is what real progress looks like, not chasing numbers with panic, but rebuilding the inner conditions that make healthy pressure possible in the first place. CO